o'clock, so let's make a start. Morning, everyone. Thanks very much for joining this event, which we have called a roadmap for an ethical AI in healthcare. It's quite ambitious, right? That's our aim, our desire would be to be able, I'm not sure if we will be able to make the whole roadmap, but still, at least trying to delineate what are the main challenges, the main focuses we should be considering to build an ethical AI in healthcare, which is not easy at all. We don't quite understand what it means to be ethical. What are the ethical principles we should be considering, especially for healthcare. We are not using or talking about any AI. It's a very difficult and a very important AI because it's going to be dealing with the health of all of us, and it's already there. It's already being determined our health. So let's try at least to discuss, let's try to reflect together about how we could get to a better AI for all of us that can benefit all of us. So, let me take this. First of all, welcome everyone, and I wanted to say this is an international event. We have people from Catalonia, so bon dia, als catalans. Also, we have people from Wales, so bore da in Welsh to everyone. And good morning. I know that probably there are other nationalities I'm not considering, sorry about that, but I hope that every one of you can feel represented in this event. So, you know, artificial intelligence, this is very, very promising for an application in healthcare. You know perfectly as well that there are governments all around the world that are making big investments trying to integrate AI and trying to improve routine care by using AI. Here in the UK, the government has just recently said that they want that AI and data should be transforming the prevention, early diagnosis and treatment of chronic disease by as earlier as 2030, which is really, really close. This is very ambitious. We know that there were the first two AI systems that were approved in the US in 2018. And now there are some few more that are implemented here in the UK as well. We have, for example, the HeartFlow's AI technology. This is creating 3D hearts so that clinicians can understand where blockages of the blood are happening, and just by looking at this 3D generated using AI hearts. The pseudoscience, which is being used in the UK to identify patients that are at risk of cancer. This is being done earlier and faster than ever, thanks to the AI. There are the DeepMind AI technology. We will have Nena Thomasev from DeepMind joining us in the afternoon. And this technology is being able to automatically identify different sight-threatening eye conditions. And also the Brainomics e-stroke, you might have heard about it. This is a brain scan software that is being used to diagnose a stroke, and that is being shown, demonstrated to be tripling the number of cases that are recovering from the stroke. So these are very nice examples of AI tools that are at the moment being used in the UK. But for some reason, we are going to be trying to decipher today. The hype hasn't been really going as fast as one would have expected. For some reason, despite the big effort that we are all doing and making to develop cutting-edge AI, the systems are still being implemented slower than hoped. This is what has been called by Eric Topol, many people working in the area, like the implementation gap. What are the reasons for that slow implementation of AI in healthcare? What are the reasons for the implementation gap? Well, a lot of research on the area naming that key reasons for this are basically ethical challenges that are inherited to these tools, right? What are the ethical challenges? What are ethics? If I would ask you what are the ethical values, probably you would answer different things, right? And it will depend on your culture and or your origin or just your beliefs, right? So that's an important first question. What are the values we should be aligning AI with for healthcare? The second question is, what can we do to mitigate these problems? What can we do to ensure that we have a safe and medical AI? it's even possible to make an AI which is ethical, which is non-biased, which is non-discriminatory. Do we have the tools to do that in real practice? This is why we are here today. There are many challenges. There are lots of people around the world trying to create guidelines, to create standards, so that we know what are the ethical challenges and how to tackle them when we AI developers, develop AI tools. For example, we do have the Topol review made by Eric Topol and his team, and he was committed with doing a report, this independent report that was asked by the Secretary of State for Health and Social Care in February 2019. And it's more general, because that was to prepare the healthcare workforce to deliver a digital feature, but it was also covering, very interestingly, the side of the ethics of AI. Then, of course, one of the most important standards, I would say, for the ethics of AI in healthcare, which is the guidance by the World Health Organization. And then, why not? There are smaller local initiatives that we have done here at King's, and trying to not only decipher which are the ethical principles, but also trying to translate these ethical principles in something meaningful, in something that can be really put in action, something that is aiming to trigger the action of people, right? And for example, here we published this paper, which is called The Human Role to Guarantee an Ethical AI in Healthcare. We were defining a facts approach, and it was trying to, putting together all this information in a very simple manner, and trying to, what I said, saying, if I'm a clinician, what should I be using? What should I be doing to ensure that AI is ethical? Well, if I'm a patient, do I have a role as well? Can I do something so that AI is ethical? Yes, patients can do a lot as well. And developers, of course. Developers have a lot to do, right? To get to an AI that can be at least more ethical. So, but many initiatives that they look to be independent. Well, they are not. Something that we found, looking at different sources, and that there was a lot of overlap between different works. So if you put together in the second column, you have the literature review of 45 research papers defining the most prominent ethical principles. And we found that there were 12 ethical principles or dilemmas that were the most frequent across literature. Then on the first column, you have the 4 pillars of the bioethics. This has been in place since 1972, or 1979, sorry. Yeah. These are the principles that everyone knows when you develop the clinical activity. They were not created for the AI era at all. But the funny, interesting thing is that they work very well for the AI as well, because they are mentioning respect for autonomy, non-maleficence, justice, beneficence. These are things that should apply to the AI as well. And then finally, the World Health Organization guidance. There are many ethical principles that are matching the others. So there is overlap. There is overlap. So why we don't have so many independent guidance, right? I think that the world needs a global ethics of AI approach. From academia, from policy, from governments, from health organizations, World Health Organizations. There were the AI Safety Summit here in the UK, exactly 1 year ago, November 2023. We were discussing on AI safety, on regulation. We aimed to coordinate international action. There were people from all over the world coming, not just governments, but also from important companies. There was also, of course, the European AI Act. This is the world's first comprehensive AI law that was developed by the European Parliament. Basically, the law is about ethics. They were mentioning key words of ethics. They talk about transparency, about safety, about non-discriminatory, environmentally friendly, right? So when we talk about defining a good AI, yes, it's everything about ethics. But we're keep on doing things independently. There is also this National Security Memorandum on AI just announced in the US. US aiming to create a stable international framework for responsible AI development. And even more, we have the Framework Convention on AI that was a first ever international legally binding treaty. This is aiming to put all of this together to make something international. The same like the Vita Manifesto for advancing trustworthy AI. That was just signed this week, well, the last week actually, Albert was there, and that was promoted by the Catalan government and has been signed by 14 regions all around the world. Is that correct, Albert? Yeah. So there are different initiatives trying to pull all of this together, but still there are independent initiatives as well. So why cannot put and make a final, document or standard for ethics of AI? I think that would be really necessary. Who should be involved? Yes, governments, ministries of technology, ministries of health, ministries of information. But we were also publishing in 2023 that patients, developers, clinicians, and patients were key as well. So I think that there are like two different spheres that should be considered. One that is closer to the patient, the clinician, and the AI developer. And then the second sphere, or global sphere, involving the governments. But of course, always considering that the patient should be at the center upon any development and implementation of any new technology. So, having said that, I thought, let's try to do something else here. Let's try to put together some efforts internationally. And I got this project from the UKRI, from Responsible AI UK, the project, The Human Role to Guarantee an Ethical AI in Healthcare. And I invited some colleagues from Catalonia, Manuel Armayones, who's the coordinator at the Behavioral Design Lab at the Open University of Catalonia, Universitat Oberta de Catalunya, and Albert Royo, who's the Special Envoy for Technology, Innovation and Science in the government of Catalonia, Generalitat de Catalunya. And it's also very involved. I never know exactly how to say it. Sorry? What is your role exactly?
Well, we're basically promoting this initiative, which is a coalition of governments willing to take the most out of technology, but with a clear ethical, let's say, stand.
Lovely. Yeah. Thanks, Albert. And then me as well. I'm Dr. Raquel Iniesta. I'm a reader in machine learning for precision medicine. I've been working at King's College London for almost 11 years now. And I'm leading the FIR Machine Learning Lab, which is part of the prediction modeling group, which is led by Professor Daniel Stoll, which is also here with us today. So, yeah, we got this project. We were very happy of getting it. And this is why we are here. One of the focuses of the project was to foster discussion on the ethical challenges of the medical AI across international stakeholders. Let's try to do this today. I think that this is an extremely relevant moment. We have the opportunity to be discussing on very important questions, very sensible matters. One of the things I'm sure we will speak about today will be about accountability, about responsibility. So one reasonable question is, once the AI has made a decision, who has responsibility on that decision? The clinician, is the developer, is even the patient responsible? What can developers, governments do to ensure that AI works for all? No discrimination, non-bias. How we can avoid disempowerment of clinicians and patients in the presence of an AI system, in the doctor's visit. How to integrate clinicians' knowledge on AI-driven decisions. Should the clinician's knowledge be respected, even if it's contrary to the response by the AI system? How should we deal with this? How to build trusty AI systems. Trust is a key word on ethics of AI. Reliable as well. Avoiding the humanization of patients. Building transparent tools and non-discriminatory. Of course, problems on data privacy, security. And very important, I think, education and AI literacy. How can we make this accessible to everyone? To patients, to clinicians, and to developers, of course. So this is why we are here. This is a whole day event. In the morning session, we're going to be just opening with Sara Cerdas, that will be giving the first talk. Then Rupert Childers will follow her. We will have a break, and then we will have a first panel discussion with all these interesting and awesome speakers with us. Then will be the lunch break at 12:50. And then in the afternoon session that we have called Human Actions to Align AI with Ethical Values in Healthcare, We will have the first two talks, one by Professor Payan Barnaghi, second by Professor Susan Shelmerdine, and then we have a break as well, and then a second panel, and we will finish. I hope that you will enjoy. You don't know that there's someone else attending this event. That person, have you ever been in the Basque Country? Have you ever been? None of you? Yeah. It's very nice, right? Very good food. Yeah. Yeah. So there's someone there who can be enjoying this at the moment, who's Javier Miguel Garay. He's an artist, and he's doing live infographics for us. So, as you're speaking, he will be drawing. Okay? You don't see him, but I promise he's there. And from Donostia. And at some points in the breaks and the lunch, we will be screening what he has created, okay? It's going to be very nice. You will love it. This one was created by Javier when I was attending Barcelona and a talk with Manuel. And I was really amazed. All the ideas I really said, they were in the infographic. So I got in love, so this is why Javier is with us today. Anyway, this is the program, so let's make a start. So the presentations of the two speakers will be done by Albert Royo. So when you're ready, thank you.